ever get that feeling? Like you totally nailed a test, but then later you realize like you couldn't really use any of that knowledge?
Oh, yeah, for sure. Like you crammed a bunch of random facts and then poof, gone 5 minutes later. Happens all the time.
Right. Like what if the way we measure like what we actually know is like totally missing the point?
Totally.
What if figuring out the science of how to test well could actually make us better learners?
Ah,
That's what we're diving into today.
awesome.
Welcome to the deep dive, where today we're going to unlock some of the secrets of effective assessment in medical education. We've got this really interesting collection of resources to guide us.
Cool.
And for you, our listener, you know you're all about cutting through the noise and really getting to the core of how learning works. So we've distilled these materials down to the essentials just for you.
Nice.
Our mission today is to explore what makes a truly valuable assessment and why it's so important for building, real expertise.
Before we jump in, just wanted to give a huge shout out to London Heartbeat's Z Academy UK for their amazing educational support that makes deep dives like this possible.
Absolutely.
And if you're looking to expand your knowledge base, they've got over 150 popular courses definitely worth checking out. You can find them on Facebook, Instagram, and YouTube. Just search London Heartbeat's Z Academy.
Fantastic. So in this deep dive, we're going to peek behind the curtain and see how educators think about testing knowledge.
Okay.
We'll explore all sorts of tools they use, from essays to those dreaded multiple choice questions. And we're going to really break down the pros and cons of each.
That was good.
Our goal is to help you understand, like at a deeper level, how true comprehension is actually measured.
Okay, I'm ready.
All right, so let's get into it. The most basic reason we even have assessments is to figure out what's been learned.
All right.
And maybe even more important, what hasn't been learned.
Yeah, it's absolutely.
It's like a feedback loop, right?
Exactly.
Assessment helps educators see like where students are in their learning process and where they might need some extra guidance.
Mm-hmm.
And for you as a learner, a good assessment can really pinpoint those areas where your understanding is rock solid and where you might need to, double down.
Yeah, I see that.
But it makes you wonder, right? Are educators always 100% clear on what they actually want to test?
Right.
It seems obvious, but if we're talking about like genuine understanding and being able to actually apply knowledge, do all tests actually measure that?
That's a great question. And I think the flip side of that is, do students always understand what the educator's really looking for?
Right.
Sometimes there's a mismatch,
Yeah.
If the way you measure success is kind of vague, or if the test is all about spitting back facts without any real context,
Mm-hmm.
then it's really hard to know if someone truly gets it. It becomes this memorization game instead of really understanding.
So how do we get past that? How do we move beyond just testing if someone can remember stuff?
Well, according to these resources, the key is to link assessments directly to the core competencies that students are supposed to learn.
Okay.
It's all about making sure that what you're testing lines up perfectly with what students need to be able to actually do.
Mm-hmm.
This also means making things clear and transparent in the assessment process. Like everyone knows the rules of the game,
Right.
and we need to minimize something called construct underrepresentation.
Construct underrepresentation. Okay, that sounds pretty complicated.
Yeah.
Can you break that down for us in like normal human language? What does that actually look like?
Okay, so imagine you're trying to judge someone's ability to cook.
Okay.
Like a really complex dish, right?
Yeah.
But all you ask them to do is recite the recipe.
Mm-hmm.
They might know the recipe by heart,
Mm-hmm.
but that doesn't tell you if they can actually, chop vegetables, saute stuff, or blend those flavors together.
Yeah.
That difference between what you meant to test, the
Mhm.
cooking skills, and what you actually tested, the recipe memorization, that's construct underrepresentation.
Mm.
And in medical education, it might look like an exam that focuses on these random, obscure facts instead of the critical thinking you need to diagnose and treat patients.
Gotcha.
It happens when a test leans too heavily on rote memorization or when the questions don't cover the really important stuff. It could even happen if the teaching is too narrowly focused on just what's going to be on the exam.
So like an exam that just asks for lists of symptoms wouldn't really test if someone can put all those symptoms together to figure out what's wrong with the patient.
Exactly. To get past this, assessments need to include questions and tasks that require higher level thinking, like analyzing a patient's history, connecting different pieces of information, and weighing the pros and cons of different treatment options. The goal becomes assessing their actual competence. Can they use what they know to solve real-world problems?
That makes a lot of sense. So how do educators ensure that they're getting at those higher order thinking skills and avoiding those construct underrepresentation pitfalls?
The materials emphasize the absolute importance of a blueprint. Think of it as like a detailed plan for your assessment, like an architect's blueprint.
Okay.
This blueprint makes a clear connection between the assessment and the learning objectives of the course.
Right.
It also makes sure that the most important skills students need to learn, the core competencies, are woven into the assessment. And the amount of each competency is based on how crucial it is to the overall curriculum. By having this clear, structured plan, you can really reduce construct underrepresentation and make assessments that are more focused, meaningful, and transparent in what they're meant to measure.
I like that. A blueprint for testing. Okay, so once you've got this blueprint in place, what's next? How do you actually create the exam questions?
It starts with going back to those core competencies
Yeah.
and the specific learning objectives you want to assess.
Okay.
Then you have to figure out how much emphasis to give to each objective and to different areas within the subject matter. This ensures that the assessment accurately reflects how important different topics are. And finally, you decide on the types of questions you'll use. Will it be mainly long answers, short answers, multiple choice, or a mix?
So it's more than just picking questions that seem relevant. It's a much more deliberate process.
Definitely. The materials stress that questions should be carefully selected to align with every single competency that's been taught.
Right.
And the number of questions on each topic should reflect the weighting that you decided on earlier. There's also a big emphasis on focusing on the fundamental concepts and techniques of the subject.
Yeah.
You want to make sure you're testing those core foundational pieces of knowledge.
Okay, so what about different kinds of knowledge, like knowing a fact versus being able to actually apply it?
Right.
Are they all assessed the same way?
Ideally, you want to tap into all three main areas of learning.
Okay.
What you know, which is called cognitive, what you can do, which is called psychomotors, and your attitudes and values, which is affective. While this particular set of materials focuses mainly on the cognitive aspects, it does mention that assessments should prioritize conceptual understanding, the why behind the facts, and those higher-level cognitive skills that involve applying and analyzing knowledge.
Okay. So you've got your blueprint, you've got your questions lined up with the competencies and weighted appropriately. Is the exam ready to go at that point?
Almost, but not quite.
Mm-hmm.
There's one more super important step: moderation and acceptance of the question paper.
Okay.
This means carefully checking the structure of the exam, the topics it covers, how difficult the questions are, and how long it should take students to complete it.
Mm-hmm.
This helps guarantee that the assessment is good quality, fair, and appropriate before you give it to the students.
Perfect. So now we've got this super well thought out question paper. Let's talk about the different types of written questions. Let's start with those essay style questions, the long answer ones.
Okay, sounds good. Long answer questions usually fall into two main categories.
Okay.
Traditional essay questions, which can be more open-ended or structured,
Hmm.
and then modified essay questions, which are often called MEQs.
All right. Let's start with those traditional essay questions. What are the good things about using those in an assessment?
Well, one of the main advantages is that they're relatively easy for educators to write. They can also provide a thorough way to assess a student's understanding of a broad topic,
Mm-hmm.
plus their ability to think logically and organize their thoughts, and how well they can express complex ideas in writing. Essay questions can also test those higher levels of brain power, like when students have to analyze information, synthesize different concepts, and really evaluate arguments.
Yeah, that makes sense. But I remember taking essay exams, and sometimes it felt like my grade depended more on my writing skills than what I actually knew. Are there any downsides to this format?
Absolutely. Essay questions often have what's called low validity because in a timed exam, they can only cover a small part of the course material.
Right.
They're also pretty time-consuming to grade well, which
Yeah.
can be a burden for teachers.
Yeah, I bet.
And you're right, one of the big drawbacks is the potential for bias from the person grading. Different instructors might grade the same essay differently.
Right.
Plus, essay questions can sometimes reward students who are good at, bluffing or writing really persuasively, even if they don't really understand the material.
Yeah.
And as you pointed out, the grading can be inherently subjective.
It's funny you mentioned bluffing. I totally remember trying to fill up the page even when I wasn't sure of the answer.
Yeah, we've all been there.
What other things can make grading essays unreliable?
Well, unfortunately, there are several things that have nothing to do with the student's knowledge that can affect their grade.
Like what?
Things like how neat their handwriting is, grammatical errors, how well they use diagrams, or if they underline important points. Even the type of pen they use can sometimes unconsciously sway the grader, even if they don't mean to.
That doesn't seem very fair. So how can educators write essay questions that minimize these issues? How can they make essay questions a more effective assessment tool?
The key is to make the questions very specific and focused.
Okay.
Instead of a really broad question like, discuss the causes of heart failure, a better question might be, describe the main mechanisms that lead to left ventricular heart failure, explaining the body's attempts to compensate and how those can sometimes backfire. You can even break the question into different parts and assign points to each part. That way, it's clearer what students need to cover and how their answers will be graded.
Right. So being specific and breaking down the question into smaller parts makes a lot of sense. What about the actual wording of the question itself?
The language should be clear, concise, and straightforward. The main goal is to test their scientific knowledge, not their creative writing skills.
Mm.
And it can be helpful to include specific reference points or background information within the question when needed. That way, everyone has the same starting point.
That makes sense. So we've got well-written questions. Now, how do you make sure you're grading the answers fairly?
The grading should be based only on the specific learning goals that the question is designed to assess. Right. It's crucial to have enough time to carefully read and score each answer.
Mm.
It's usually best to grade all the answers to one question across all the students before moving on to the next question, instead of grading one student's entire paper at a time.
Okay.
Hiding the students' names can also help reduce bias.
Mm-hmm.
And if you can, having multiple people grade the answers and then averaging their scores can really improve the consistency of the grading.
That makes sense. And as you mentioned earlier, instructors should try to avoid being swayed by things like handwriting or minor grammar mistakes, unless they really make it impossible to understand the content.
Exactly. If you do all of this, long essay questions can become a much better and fairer way to assess a student's understanding of a topic.
So you also mentioned another kind of long answer question, modified essay questions, or MEQs.
Yeah.
What are those all about? How are they different from traditional essays?
MEQs are like problem-solving exercises that are based on a real clinical scenario or case study. Instead of talking about a topic in general terms, students are given a specific situation.
Okay.
Then they're asked a series of targeted questions that require them to apply their knowledge to that particular case.
Can you give us an example of what an MEQ might look like?
Sure. Imagine a 35-year-old woman comes in complaining of fatigue, weight loss, and being really sensitive to heat. Her exam shows a fast heart rate and a slightly enlarged thyroid gland. The questions might ask for the most likely diagnosis, what initial tests you'd order, what you'd expect to find from those tests, and how you'd manage the condition. Each part of the question would be worth a certain number of points.
So it's like walking through a clinical problem step by step. What are the benefits of using MEQs on exams?
One of the biggest advantages is that MEQs can focus on specific areas of knowledge and clinical decision-making. They're really effective at testing how well students can combine their basic science knowledge with their clinical knowledge to solve a realistic patient problem. Because the questions are usually very focused and follow a logical progression based on the scenario, there's less subjectivity in the expected answers compared to open-ended essays.
That makes sense. Are there any downsides or challenges to using MEQs?
One potential issue is that if a student misunderstands the initial part of the scenario or gets the first question wrong, it might make it harder to answer the following questions correctly.
Yeah.
However, you can minimize this by making the sub-questions as independent as possible. Another challenge is that creating well-structured and realistic MEQ cases can be pretty time-consuming for faculty. And just like with any assessment tool, once an MEQ has been used, it might not be as effective in the future if the case becomes well-known.
So you need to create a lot of different scenarios and be thoughtful about how you construct them. What are some key things to keep in mind when you're developing MEQs?
It all starts with coming up with realistic and clinically relevant scenarios that match the learning objectives.
Okay.
It's helpful to create a basic outline of the case and the main learning points you want to test. Each question should clearly target a specific piece of knowledge or clinical skill. And as with any good exam question, the wording should be clear, concise, and easy to understand so there's no confusion.
Gotcha. Are there any general principles that apply to both traditional essay questions and modified essay questions?
Yeah, definitely. It's always a good idea to get a group of faculty members involved in creating and reviewing these types of questions. This ensures that the information is accurate and relevant, and it's super important to create a model answer, ideally with a detailed scoring guide that everyone on the faculty agrees on. Lastly, Try to make the questions as independent from each other as possible so that getting one part right doesn't completely depend on getting a previous part right.
Okay, so we've covered the longer form questions. Now let's switch gears and talk about something a bit shorter. Short answer questions, or SAQs. What's the main reason for using these on exams?
The main goal of SAQs is often to test recall of specific facts, concepts, or procedures in a more straightforward way. They minimize the impact of writing style and long explanations, which can sometimes affect how essay questions are graded.
Right.
SAQs tend to test lower to middle levels of cognitive skills and are especially useful for testing knowledge in areas where you want objective and reliable scoring.
What are some of the different formats that short answer questions can have?
There are a few common types. Completion-type SAQs give you a statement with a blank that you need to fill in to show you remember a specific piece of information.
Okay.
Unique or one best answer type SAQs require a very specific, often one word or short phrase, answer.
Mm-hmm.
And then there are open-type SAQs, which might ask you to list a certain number of things or briefly describe a concept. These allow for a bit more flexibility in how you answer.
Okay. So what are some tips for writing good short answer questions? What should educators keep in mind to make sure the questions are clear and fair?
The most important thing is that the question or task should be super clear, leaving no room for interpretation or ambiguity. The language should be simple and direct, and the question should be worded in a way that leaves no doubt about what's being asked.
Can you give us an example of a poorly written SAQ and then show us how to make it better?
Right. Sure. A vague SAQ might be something like, treat hypertension with this.
Oh, okay.
This is bad because there are many different types of medications used to treat high blood pressure.
Right.
A much better way to phrase it would be, name a class of antihypertensive drugs that mainly works by blocking the renin-angiotensin-aldosterone system. This makes it clear what kind of answer you're looking for.
I see. That clarity is important. What about short answer questions that have numerical answers, like lab values or dosages?
For those, it's always a good idea to include the unit of measurement and, if necessary, a specific context or reference point. For example, instead of just asking, what is a normal blood glucose level? You could ask, the normal fasting blood glucose level is between atenias and milligrams per deciliter. This gives the student the context and the units they need to answer correctly.
That makes sense. Are there any other common mistakes to avoid when writing SAQs?
Yes. Be careful not to accidentally give away clues in the way you phrase the question.
Mm-hmm.
For instance, using a or an before a blank can hint at whether the word starts with a vowel or a consonant.
Right.
Also, the length of the blank space should not suggest how long the answer should be.
Good point. So what are the pros and cons of using SAQs on exams?
Well, from the educator's point of view, SAQs are usually easier and faster to create than essay questions or those complex MEQs.
Okay.
And from a student's perspective, they're usually pretty straightforward to answer and are graded more objectively. SAQs also let you cover a wider range of topics on the same exam.
Mm-hmm.
However, one of the main limitations is that they mainly test recall and those lower-level thinking skills. Also, students usually need more time to answer several SAQs compared to the same number of multiple-choice questions. So you might not be able to test as much material in the same amount of time.
Okay.
And even though they're more objective than essays, those open-ended SAQs can still have some subjectivity in how they're graded.
Okay, now let's move on to what's probably the most common type of question in medical education. Multiple choice questions, or MCQs. Why are they so popular?
There are a lot of reasons. For one, they offer a high level of objectivity in scoring, since there's usually only one right answer.
Right.
They can efficiently test a wide range of knowledge and concepts in a single exam. They can also be designed to assess not just recall, but also higher-order thinking, like applying information and analyzing situations. And when you have large-scale assessments, MCQs are easy to grade and often require minimal time and resources.
Yeah, I can see why they're so popular with educators. But anyone who's taken an MCQ exam knows that sometimes you can guess the right answer even if you don't fully understand the concept. What are some of the downsides of MCQs?
That's a good point. Writing good MCQs that really test understanding and minimize guessing takes a lot of expertise and time.
Yeah.
The quality of the question really depends on how well it's written.
Right.
And like you said, those distractors, those wrong answer choices, can sometimes help students get to the right answer by process of elimination, even if they don't actually know the material.
Yeah.
And of course, keeping a large set of MCQs secure and preventing cheating can be a logistical nightmare.
So what makes a really good MCQ?
A great MCQ should be valid, meaning it accurately measures what it's supposed to measure. reliable, meaning it produces consistent results, objective in its scoring, feasible to implement within the given constraints, and fair to all students. It should also be the right level of difficulty for the students taking it.
When educators are creating MCQs, what are some of the most important factors to consider?
They should make sure to cover all the essential parts of the course material. They should really emphasize testing those core concepts and principles. And they should try to create questions that require students to apply their knowledge, not just regurgitate facts.
Okay, let's break down the parts of an MCQ. What makes up a typical multiple choice question?
Sure. A standard MCQ has a few key components. First, you have the stem. This is the part that presents the problem, the scenario, or the question itself. Sometimes the stem includes a laden phrase that sets the context. Then you have the choices or options. These include the key, which is the correct answer, and the distractors, which are the incorrect but plausible choices.
Can you give us a quick example to show us how these different parts work together?
Sure. Let's say the stem is a 60-year-old patient with a history of smoking comes in with a chronic cough and shortness of breath.
Okay.
The lead-in could be, what is the most likely diagnosis?
Mm-hmm.
And then the options could be A, acute bronchitis, B, pneumonia, C, chronic obstructive pulmonary disease, or COPD, asthma.
Okay.
In this case, C, COPD would be the correct answer, and the others would be the distractors.
So what are some general rules for planning and writing a well-constructed MTQ?
Well, first, you need to know who you're writing the question for and what specific learning goals or competencies you're testing. Then, you should look at all the important topics in the curriculum and focus on writing questions that test higher-level thinking whenever possible. Don't just ask for simple recall, and make sure the language you use throughout the MCQ is clear, concise, and easy to understand.
So let's talk about the STEM, the first part of the question. What makes a good STEM?
A good STEM is the foundation of a good MCQ.
Mm-hmm.
It needs to present a clear and focused problem or question. Ideally, a student who really knows the material should be able to answer the question even before looking at the answer choices. This is sometimes called a hand cover test.
Okay.
Don't use stems that are too short or incomplete. The main point of the question should be in the stem itself, not split up among the answer choices.
What about using negative statements in the STEM, like which of the following is not? Is that generally a good practice?
It's generally best to avoid negative wording in the stem because it can confuse students.
Okay.
But if you absolutely have to use a negative statement, make sure the negative word like not or except is clearly emphasized. Maybe capitalize it, underline it, or make it bold. And always, always avoid double negatives in the stem. Those are just too hard to understand.
Yeah, for sure.
The stem should also focus on one specific concept.
Okay.
Get rid of any extra information that doesn't directly relate to the problem.
Mm-hmm.
And finally, be super careful that there are no accidental hints in the stem that might give away the right answer.
So once you've got a clear STEM, what are some guidelines for writing good answer choices, both the right answer and the distractors?
The answer choices should all be grammatically correct and consistent with the stem, and they should have a similar structure.
Okay.
Avoid obvious wrong answers. Those are sometimes called bogeys.
Okay.
They don't really test anything.
Yeah.
There shouldn't be any unnecessary overlap or repetition between the choices. If the choices involve numbers or sequences, they should be presented in a logical order.
Okay.
And the stem shouldn't give away whether the answer should be singular or plural.
Right.
It's best if all the options are about the same length and complexity.
Mm-hmm.
And generally try to avoid using all of the above and none of the above as options.
Okay.
They can sometimes make the question too easy or introduce unnecessary complications.
Makes sense.
The correct answer, the key, should be clearly the best choice among the options. And avoid using extreme words like always or never in the choices.
Yeah, okay.
Those are often clues that the answer is wrong. Finally, mix up the position of the correct answer in different MCQs so students can't just guess based on a pattern.
Good tips. So what are the main things you're aiming for when writing multiple choice questions?
The main goal is to make questions that match the learning objectives and accurately test how well a student understands and can apply knowledge. Ideally, MCQs should test higher-level thinking skills, going beyond memorization to things like analysis, interpretation, and problem solving.
Right.
There are frameworks, like Bloom's taxonomy, that help classify different levels of cognitive complexity.
Okay. And how can educators know if an MCQ is actually effective after they've used it on an exam?
That's where something called item analysis comes in. Item analysis looks at the data from student responses to each question on the exam.
Okay.
It tells you how hard the question was, how well it separated high-performing students from low-performing students, and how good the distractors were at, distracting students.
Yeah.
This data helps teachers find and fix questions that aren't working well, which ultimately improves the quality and reliability of their assessments.
You mentioned post-validation earlier. Can you explain what that means for MCQs?
Post-validation is basically checking how each MCQ performed after it's been given to students. By looking at the data from student answers, educators can figure out if the question worked the way they intended. This helps them spot questions that were too easy or too hard, questions that were confusing, or questions where the wrong answer choices weren't very effective. This process is crucial for making sure the MCQs are good quality and fair.
What are the main things that are examined during item analysis of MCQs?
The main things you look at are the difficulty index, sometimes called the facility value.
Okay.
This tells you what percentage of students answered the question correctly. Then there's the discrimination index, which measures how well the question distinguishes between students who did well on the whole exam and those who didn't. And finally, you look at the distractor effectiveness, which shows how well each of the wrong answer choices drew students in.
What do the different ranges of difficulty index usually tell you?
If the facility value is very high, like over 80%, it usually means the question was very easy. A moderately high FV, between 60% and 79%, suggests it was relatively easy.
Okay.
The ideal difficulty level is usually considered to be between 40% and 59%.
Yeah.
A moderately low FV, between 20% and 39%, means the question was difficult. And a very low FV, below 20%, usually indicates that the question was very hard or maybe even flawed.
You also said that the discrimination index should ideally be positive. What does it mean if the discrimination index is negative or low?
A negative discrimination index is a big red flag.
Oh, no.
It means that students who did worse on the exam were more likely to answer that question correctly than students who did better overall.
Huh.
This usually points to a problem with the question itself. Maybe the wording is confusing, or maybe the answer key is wrong.
Yeah, okay.
A low positive discrimination index means the question isn't very good at telling the difference between students who understand the material and those who don't.
And what do you look for when you're analyzing how well the distractors are working?
Ideally, you want the wrong answer choices to be believable enough to attract a decent number of responses, especially from students who don't fully grasp the concept.
Okay.
If very few or no students pick a particular wrong answer choice, it's not doing its job. On the other hand, if a lot of students, including those who did well overall, pick a certain wrong answer, it might mean that the choice is unclear or maybe even a better answer than the one you intended to be correct.
It seems like creating good MCQs is much more involved than just coming up with questions. There's a whole process of analyzing and refining involved.
Absolutely. The materials really highlight that educators shouldn't just stop after writing an MCQ.
Right.
All MCQs should go through this post-validation process using statistical analysis and expert review. Only by doing this can they be confident that their questions are accurately and fairly assessing their students.
So a well-designed MCQ should be able to clearly differentiate between students who understand the material and those who don't.
Exactly. A collection of well-written and tested MCQs is a big part of creating comprehensive and authentic assessments. However, it's important to remember that no single type of assessment is perfect.
Right.
Using a mix of different assessment types is usually the best way to get a complete picture of a student's knowledge, skills, and abilities. This applies to both providing feedback during the course and making final judgments about their overall performance.
This has been a fascinating and in-depth look at the principles and methods of assessment in medical education. We've gone way beyond simply listing question types and really explored the thinking behind creating effective evaluations.
I agree.
And for you, our listener, we hope this deep dive has given you a better understanding of how educators carefully design assessments to be fair and meaningful. The goal is to test genuine understanding and the ability to use knowledge, not just memorization.
Absolutely.
This understanding can empower you to approach learning and assessments in any field with a more informed and discerning eye.
That's a great point.
And on that note, here's something to think about. We've uncovered the complexity of designing good assessments in medical education. What broader lessons can we learn from this and apply to how we evaluate knowledge and skills in other professions and in life in general? How can we make sure our ways of assessing truly reflect competence and the ability to actually use knowledge in real-world situations? It's a question worth pondering as you continue to learn and grow. Thanks for joining us on this deep dive.
Thanks for listening.